You know, this is a COVID year. Just accept it. It's not like last year, and it's not hopefully not going to be like next year. So if you really love the people that you have in your immediate family, think through this and actually do them the greatest gift of all. That is distance yourself and don't expose them. Meet the Press, October 18, 2020. Good morning, good afternoon, good evening. My name is Ahmad Daffa and I'm here today to talk about the coronavirus disease or COVID-19. To begin with, we're going to talk about what it actually is COVID-19. COVID-19 is an infectious disease caused by the coronavirus SARS-CoV-2, which is a respiratory pathogen. The WHO first learned of this new virus from cases in Wuhan, People's Republic of China, on 31 December 2019. Most people infected with COVID-19 will experience mild to moderate respiratory illness and recover without requiring special treatment. Older people and those with underlying medical problems like cardiovascular disease, diabetes, chronic respiratory disease, and cancer are most likely to develop serious illness. Now let's take a look at the number of cases around the world. On this date, 2nd of November 2020, the WHO reported around 46,166,182 confirmed cases and 1,196,362 confirmed deaths around the world, and we can divide that with America with 20,616,596 confirmed cases, and Europe with 11,062,715 confirmed, Southeast Asia with 9,305,253 confirmed, Eastern Mediterranean with 3,383,628 confirmed, Africa with 1,324,258 confirmed, and Western Pacific with 737,099 confirmed. Now that we know the number of cases around the world, I am here to talk about the solution of this pandemic, especially for our country, Indonesia. I have basically just gathered around information of methods that other countries use to significantly reduce the amount of cases on their area. And I've put together the WHO recommendation. So there are a lot of methods out there, but I just summed them up to 4 different solutions. Number 1, mapping demand for medical supplies. Even knowing what equipment where will be a particular challenge in countries where public health information systems are weak. This will enable government to see the needs of different health facilities or even their existing capacity in real-time detail. It will also help humanitarian agencies, businesses, and local manufacturers to respond where suppliers are low. Number 2, open source local production. The COVID-19 response could incorporate ideas such as this and tap them into the dynamism of open source design and engineering communities. Government should consider designating local makerspace that use tools such as 3D printing tools as social infrastructure, allowing them to continue to operate during lockdown. Connecting them to hospitals and clinics could provide local manufacturing capacity that could help with supplying essential items like personal protective equipment and spare parts. Successful designs could then be scaled up by local manufacturers with greater production capacity. Number 3, identifying community assets. There is already emerging evidence in the UK that crowded living conditions accelerate the spread of COVID-19, and globally, up to 1 billion people live in densely populated slums, repurposing the likes of schools and churches, Masks could enable those with COVID-19 symptoms to self-isolate quickly. Mapping tools such as OpenStreetMap could be used to identify the location of such assets in partnership with municipalities, businesses, and community organizations. Humanitarian OpenStreetMap is already mobilizing its volunteers mapping communities, while Open Cities initiatives have substantial expertise in community mapping for crisis resilience. And number four, medical hive minds. The pace of COVID-19 pandemic is so fast that the usual process of sharing knowledge via peer-reviewed journal articles is often proven too slow. Instead, doctors have been joining specialist discussion groups on social media such as Facebook, Twitter, creating a kind of medical hive mind to develop answers in real time. There may be a risk that mistakes or misinformation that is and could be amplified with this kind of rapid information sharing, and content should always be reviewed carefully and critically. But then we can always use North Korean's methods of this pandemic. One case, one gunshot, and boom, no more cases. Joke aside, that's all what can I say for today. Remember, if you want to go out, always wear your mask. And don't forget to wash your hands. And yeah, stay safe, stay healthy, and I thank you.